624.2 identifies symptoms of illnesses that can resemble substance abuse, diabetic shock and or coma, staggering, appearing drunk, breath smells sweet or fruity, epileptic episode, drunken stupor, confused state, brief periods of violence, high blood pressure, temporary irrational behavior, head injury, confusion and aggression, stroke, dizziness, confusion, vomiting or loss of consciousness, Parkinson's disease, shaking, slurred speech, appearing intoxicated, cerebral palsy or Wernicke syndrome, confusion, faulty muscle coordination, eye muscle paralysis, Alzheimer's or dementia, staggering, acting inappropriately, forgetfulness, aimless wandering. 624.3 describes stages of a drug treatment program. Detoxification, the first step, allowing the body to rid itself of the drug while medically managing withdrawal symptoms. Managing withdrawal, monitoring the acute physical and mental symptoms, agitation, confusion, cramps, convulsions that occur after chronic drug use is reduced or stopped. Drug treatment court, an intensive supervised program offered by some jurisdictions as an alternative to jail for substance abuse related charges. 625.1 describe the role of the Marchman Act to provide individuals who are significantly impaired by drugs or alcohol and potentially harmful to themselves or others with emergency substance abuse services and temporary protected custody. Operates on both a voluntary admission or on an involuntary admission status. 625.2 identify the criteria to refer a person for substance abuse services under the Marchman Act. There must be a good faith reason to believe the person is substance abuse impaired or has a co-occurring mental health disorder, and because of it has lost the power of self-control because of substance abuse and is either in need of services, but their judgment is so impaired they cannot appreciate the need or make a rational decision, or they're likely to suffer from neglect or refuse to care for themselves, or has inflicted, attempted, or is likely to inflict physical harm on themselves or another. 625.3 describe how to assess a person for a substance abuse evaluation referral. Interview the complainant or witnesses to establish the background and extent of the person's substance abuse. Establish dialogue using interpersonal skills and assess their physical condition and vital signs. If the person is injured, incoherent, or non-responsive, immediately request EMS. Use the assessment to determine if they pose an immediate threat to self or others and deliver them to a designated receiving facility while completing the required DCF form. Note, adult protective custody allows transport to a jurisdiction's detention facility. 626.1 explain how to transport a person in crisis to a medical or treatment facility. Follow your agency's memorandum of understanding and specific protocols for safe transport and custody transfer. Depending on the crisis, arrange or provide transport to a mental health facility, a hospital, a substance abuse treatment facility, a jail facility, or a shelter/safe house. Adhere strictly to agency policy regarding non-custodial transports and escorts. 626.2 document an incident involving a Baker or Marchman Act. Complete the required legal forms, which include Baker Act, report of law enforcement officer initiating involuntary examination, CFD-MH LE624.2, Baker Act ex parte order for involuntary examination, which is CF-MH 3100, or agency-specific Marchman Act forms. Ensure reports are highly detailed, documenting the person's actions, reactions, physical appearance, witness statements, known medications, weapons involved, and final disposition.